In this video, I'm going to go over the Glasgow Coma scale for my patient here. This Glasgow Coma scale has three different sections: an eye section, verbal response, and motor response. So first, we would start with the eyes. This would begin as you enter the treatment room. If the patient was able to open their eyes spontaneously as you enter, that would be documented as a 4. My patient has not done that, so I'll move on and ask her a question. Hello, can you hear me? My patient was able to open her eyes with a verbal stimulus. So that would be rated a 3 in that section. If she was not able to open her eyes with that sound, I would then apply pressure to one of her fingernail beds. This can be done with a pencil or pen. Just apply some pressure there. Just checking again for eye response. If she was able to open her eyes to the stimulus of pain, that would be considered a 2 in this section. If there was no response to the pain, that would be scored a 1 in documentation. From there, we would move on to the verbal category for the Glasgow Coma scale. Here I would ask the patient a question. Hello, do you know your name? So my patient was unable to articulate words. This would categorize as inappropriate sounds, which would be scored as a 2 out of 5 for the verbal section. If she was able to answer my question in complete sentences and she seemed oriented, that would be considered a 5 in the section. If she was able to answer in complete sentences but seemed confused, that would be scored a 4. A score of 3 would be inappropriate words, so she would be saying, have symptoms similar to word salad, just inappropriate words for my question. And then 2 is what she presented with, the inappropriate sounds. 1 would be just no response to my question. From there, we move on to the motor response category. So here I would give my patient a command. Can you shake your head side to side, please? So my patient was unable to shake her head side to side. I would then go to provide a pain stimulus to the upper trapezius muscle. I would pinch there and check for any motor response there. Her abnormal response was extension away from my painful stimulus, which would be considered a 2 out of 6 in this category. If she was still unable to respond due to the upper trap pinch pain stimulus, I could also provide a pressure to the supraorbital notch on either side, as long as there are no comorbidities or any contraindications to that painful stimulus. So back to the scale, if I gave her the command and she was able to follow the command, that would be scored a 6 out of 6 for the motor section. If I applied pressure here and she was able to kind of brush my hand away or localize to the pain response, that would be considered a 5. For a score of 4, she would kind of swat my hand away, not necessarily localizing to the pain, but it would be a semi-normal flexion response to the pain stimulus. 3 would be an abnormal flexion response, so that would look like across the body flexion, similar to that. 2 is what she presented with the abnormal extension response, and 1, a score of 1 in the documentation would be no response to the pain at all. So for my patient, I have scored her a 3 under the I category, and a 2 in both the verbal and the motor categories, which would be a total score of 7 out of 15 for the Glasgow Coma scale.